name is Courtney Murphy, and I'm a Community Health Manager at Prevent Blindness Wisconsin, and I want to welcome you to our Client Continuum to Care presentation. This presentation is going to cover how you make an eye doctor appointment based off a vision screening referral or signs and symptoms that you may be experiencing due to a vision problem. We're also going to walk through frequency of dilated eye exams and further steps if you need specialty vision care from your eye exam. Prevent Blindness Wisconsin is a nonprofit organization dedicated to healthy vision in Wisconsin. We offer vision health education, children and adult vision screenings, and navigation to vision care to make sure you feel confident and comfortable in making your eye exam appointments. In this first module, we are going to cover what a vision screening referral means and if you are experiencing any warning or signs and symptoms of a vision problem. If you received a Prevent Blindness Wisconsin adult vision screening from someone in your community, I want you to refer to your adult vision screening results form. On the results form at the top, it will show you whether you passed your vision screening or if you were referred from your vision screening based off of risk factors for a vision problem or due to your visual acuity scores. If you were referred on for further care from your vision screening, please refer to Module 2 of this presentation for steps on how to make your eye exam appointment. If you were not vision screened from a Prevent Blindness Wisconsin vision screening, but are experiencing signs and symptoms of a vision problem or experiencing changes in your vision, please make an eye exam appointment. Common signs and symptoms of a vision problem include, but are not limited to, experiencing changes in vision in the last 12 months, seeing flashing lights, having a sudden increase in eye floaters. If you notice a curtain is falling over one side of your peripheral or central vision. If you notice any pain or discomfort, light sensitivity, anything out of the normal with your vision health, please do not hesitate to make an eye exam appointment. This module of the presentation is going to walk you through the steps on how to make an eye exam appointment based on your vision health coverage options. First, we're going to talk about how to make an eye doctor appointment with private vision insurance. If you or a family member has insurance through your work, you want to check to make sure that you have vision coverage on your plan. To figure out if you have vision coverage on your plan, you are going to want to refer to your insurance card. On the back of your insurance card, you will see there are two labels typically listed. One that is called Vision and a number listed next to it, or one called Member Services and a number listed to the right of that. To begin with, if Vision is listed with a number, call that number for Vision Services. If you do not have a Vision number listed, call the Member Services number. When you are speaking to the operator, tell them that you want to make an eye exam appointment and want to know your vision coverage options. You should ask the operator, does your vision insurance cover an eye exam and or a pair of glasses or part of a pair of glasses? Take note of this. If your vision coverage does not cover an eye exam and or a pair of glasses, please refer to how to make an eye doctor appointment with no insurance in this module. If your insurance does offer vision coverage options, ask the operator you are speaking with which clinics they would cover in the area that you reside in. Write down the clinic name, the providers that are covered under you, the address, phone number, and website. With this, choose the clinic that best suits your location. Call the clinic saying that you need to make an eye exam appointment. You are going to need to state your name, your date of birth, and the insurance that you have. When making an appointment, make sure you document the date, the time, the clinic name, the address, and if you should arrive early before your appointment time. Sometimes clinics do ask to arrive early to fill out needed paperwork. Make sure you document your appointment details. Also, the clinic should contact you 3 to 4 days before your appointment as a courtesy reminder. If you have any questions on your eye exam appointment, please call the clinic you made the appointment with. If you need to cancel your appointment, please cancel it at least 48 hours ahead of your scheduled appointment time. This can determine if the clinic will schedule you in the future or not. Next, we're going to learn how to make an eye doctor appointment with Medicaid. If you have Medicaid coverage, you should have a Forward Health card. On the back of your Forward Health card, there should be a 1-800 number. This is the member service number. If you have questions on how to make an appointment with Medicaid, please go to Prevent Blindness Wisconsin's website under our Resources tab and go to the How to Make an Eye Doctor Appointment with Medicaid worksheet. The worksheet walks you through each step on how to find clinics in your area for an eye exam. First, if you know your HMO provider on Medicaid, please refer to the chart on this worksheet. Call the number listed, and that will transfer you to a clinic to make an appointment, or it will transfer you to an operator to find a list of clinics covered in your area. If you do not know your HMO provider, you're going to refer to step 1B on the Medicaid worksheet. With 1B, it's going to take you through the steps on how to call Medicaid and figure out your HMO. There should be a 1-800 number on the back of your Forward Health card. We're going to call that number. From there, you're going to be taken through steps on which language would be best to translate over with the automated system. After you choose your language and go through the PSA steps, the recording is going to ask you for your 10-digit ID number. This can be found on the lower left-hand corner of your Forward Health card. You can either type this number into your phone or you can verbally say it. After that, they will ask you for your date of birth. Again, you can either type this into the phone or verbally say it as well. From there, the recording should tell you your name, date of birth, ID number, and which HMO provider you have. After they state the HMO provider, they will give you the number to call, so you can call that to figure out which clinics are covered for vision care services. You're going to document that down on your worksheet, and from there, we can call the HMO provider. When making an appointment with that clinic, you're going to give them your name, your date of birth, and they will ask you for your 10-digit Medicaid ID number. Again, this is found on the lower left-hand corner of the front of your Forward Health card. Once you give your contact information to the clinic you would like to make your eye exam appointment with, they will ask you who your provider is on Medicaid. Make sure you tell them you are under Medicaid and your HMO provider name. They will ensure and double check that they accept your provider. After you make the appointment, make sure you document the date, the time, the address, and the clinic location of your appointment. Please ensure that you write down if you need to arrive early to your appointment for needed paperwork. When you go in for your eye exam appointment, the clinic does require you to bring your Forward Health card, a photo ID. If you do not arrive with either one of these, they will not see you for your appointment. Also, if you are vision screened through a Prevent Blindness Wisconsin vision screening, please bring your AVS results form with you. You should leave your appointment with a copy of your prescription if glasses are prescribed. Next, we're going to talk about how to make an eye doctor appointment with Medicare. Medicare does offer some vision benefits for adults. If you have Medicare, you should have the red, white, and blue card. On the red, white, and blue card, I want you to reference the lower left-hand corner on the front of the card. It will say entitled, and then it will list the parts of Medicare you are enrolled in. When you first enroll in Medicare, you will be enrolled in what we consider original Medicare. That is Part A. Part A is hospital insurance. This consists of coverage for any type of inpatient care, skilled nursing facilities, home health care, and nursing home care. When enrolling in Medicare, it is important to make sure you are enrolling in Part B as well. This is your medical insurance. This covers preventative tests, such as flu shots, ambulatory care, and diagnostic and testing. Part A and Part B are considered original Medicare. Adults on original Medicare typically do not have any vision coverage options. However, if an adult does have an eye disease that is diagnosed, such as diabetes, glaucoma, or AMD, Part B does cover a yearly dilated eye exam. This is considered a medically necessary service. However, if you do not have a medical diagnosis of the eyes, Part B will not cover a yearly eye exam. Medicare also does not cover prescription lenses regularly. They cover one pair of prescription lenses, and that typically is after cataract surgery is complete. If you are on Part A and Part B of Medicare, you do have options for additional vision health coverage. You can enroll in Part C Medicare, which is considered Medicare Advantage plan. That is a bundled package that does offer some dental and vision health services. This does require a separate enrollment though. Additionally, you can enroll in Part D, which is prescription drug, and this can help if you do have vision conditions that do require regular prescriptions to be taken to maintain the disease, such as glaucoma drops. If you are enrolled in A, B, and D and not in Part C, you can purchase supplemental insurance on Medicare called Medigap, which can also help with vision coverage options for regular eye exams. If you have any questions on enrollment or vision coverage services for Medicare, please call the Medicare hotline. To find a Medicare provider in your network, if you do know that Medicare covers a yearly dilated eye exam for you, please visit medicare.gov or go to Prevent Blindness Wisconsin's website and click on how to make an eye doctor appointment. Our eye care county provider guides will pop up. You pick the county that you reside in, and you will see in the upper right-hand corner of those guides, there is a column that states clinics that accept Medicare. Go ahead and refer to those and call clinics that work best for you. If you do have Medicare and cannot afford an eye exam or a pair of glasses, please refer to our How to Make an Eye Doctor Appointment with No Insurance in this module. If you have any questions, please do not hesitate to call our office.
Hi, my name is Brianna Reckamp, and I'm the Business and Volunteer Manager with Prevent Blindness Wisconsin. Prevent Blindness Wisconsin is an affiliate of Prevent Blindness. Prevent Blindness partners with VSP and OneSight to bring us our vision care voucher programs. For our vision care voucher programs, we have two that cover an eye exam and glasses. One is VSP Mobilize, and one is VSP Sight for Students. The VSP Mobilize covers an eye exam and glasses for adults, and Sight for Students covers an eye exam and glasses for a child. We also have our VSP Mobilize Materials Only program and our OneSight Healthy Eyes program. These two programs cover just a pair of glasses for those who are in need. To apply for any of these vouchers, a client would need to meet the following criteria. For the eye exam and glasses program, they would need to be at or below 200% of the federal poverty level. They need to not have any vision insurance coverage, and they need to not have used the program in the last 12 months. Our glasses only program has the same criteria, but with the added piece that you need to have a glasses prescription that is less than 12 months old. When a client applies for our voucher program, they need to fill out the application. At the top, they need to fill in their information. The phone number is very important because if pieces of the application are not filled in, we will need to follow up with them to get more information, so that piece is key. Below that, we have the section if the client is applying for the glasses only program. If they're applying for the glasses only program, we need to have the full prescription date. So we need the day, the month, and the year in order to process. In the section below, we have the financial information. We will need a proof of income included with the application when it is sent in. This can be a tax form, pay stub, Social Security award letter, or a letter from the partner if the client does not have any income. The final question on the application is if they have any vision insurance coverage. So if they have Medicaid or if they have private insurance, they would check yes. If they do not have any, they would check no. This information is important. If you're applying for the glasses only program, you can have vision insurance coverage, but you need to have exceeded it and not have any further coverage for glasses. The bottom section is for our partners. A partner can fill out the bottom piece and include information such as if they would like to receive a copy of the approval application or if the application is needed in Spanish or in English. And then we can send that directly to the client in the language that they need. When a client is approved for the voucher program, they'll receive a letter in the mail. That letter will include the steps they need to take in order to make an appointment. In those steps, we will include the phone numbers they need, the information that they'll need to call our office with once they've made an appointment. For the eye exam and glasses program, they will just need to bring the approval letter with to the appointment, and they'll need to call our office with that appointment date and location.
Now that you learned the process of how to make your own eye exam appointment, and hopefully you have one scheduled now, we're going to talk about the frequency that you should be receiving dilated eye exams. For adults, it does vary. Adults between the ages of 18 to 59 years old should receive a dilated eye exam every 2 to 4 years. Adults who have a diagnosis of their eyes, whether it be retinopathy with diabetes, AMD, glaucoma, or cataracts, should receive a dilated eye exam every single year. Also, if you have family history of a vision concern or have prescription lenses, please listen to what your eye doctor recommends for how often you should receive a dilated eye exam. Lastly, adults 60 years and older should receive a dilated eye exam every single year. As adults age, the eyes age too. I want to focus on this dilation piece here too. You can see there is such a big difference between when the eye doctor dilates the eye and does not dilate the eye. They have a very narrow snapshot of the back of the eye with an undilated pupil. When they dilate the pupil, they can see the entire back of the eye, the structures, and make sure things are healthy and functioning like they should. I know dilation takes extra 30 to 40 minutes in the beginning, and the eyes can be sensitive afterwards, but it can really make or break a diagnosis. Make sure when you make your next eye exam appointment, it's a dilation. This last module is going to cover the next steps if you've been diagnosed with a vision concern from your eye exam. After going in for your dilated eye exam, if the eye doctor diagnosed you with an eye disease, these next steps are for you. We highly encourage you to take those next steps to care. This can really make or break your vision health in the long run. If you have vision coverage or medical insurance, please give them a call, state your diagnosis, and see if treatment options and consultation is covered. If you do not have any type of vision coverage or insurance, please go to Prevent Blindness Wisconsin's website under the Adult Vision Health tab. You will see Specialty Financial Assistance Programs for specialty care. Under here, you will see Froedtert and the Medical College of Wisconsin has a financial assistance program for medically necessary conditions. Please fill out this application and follow along with the steps on how to submit it. If you run into any questions on this, please do not hesitate to contact our office. It is imperative that you get in to further specialty care. This can really make or break your diagnosis and what your vision health is like for your lifetime.